Hello everybody, I have come here today to speak on diabetology, and diabetes is a major pandemic now in India, especially urban India. As you may all be aware that Kerala tops the list of diabetic patients in South India. Of that, Cochin itself is at very high risk because of the high propensity of malls in Cochin. Everybody indulges in eating out, drinking aerated drinks and eating fast food. The danger lies in the fact that most of the patients are now detected with diabetes in their late 20s and early 30s. Diabetes, as you all know, is a silent killer. There are 450 million diabetes patients in the world, of which India has 50 million diabetic patients. Of that, Kerala comprises around 20% of the diabetes in India. What can we do to counter it? Very often you are already aware that there are treatments for diabetes. That is namely insulins and oral tablets. But what everybody misses out is the lifestyle modification. You need to keep your BMI below 25 to effectively prevent the onset of diabetes, which means you should not be overweight. You have to maintain a healthy BMI. Very often people do not indulge in any exercise during a week. So you need to indulge in at least 30 minutes of aerobic activity 6 days a week. The treatment, though everybody is aware of insulin and overchase, diabetes is now far beyond all that. Now we have continuous glucose monitoring mechanisms in place, wherein you get your chart of sugar fluctuations in 3 days' time. That helps the senior diabetologist or physicians or endocrinologists to chart the optimum insulin therapy. There is also a new entity known as GLP-1 agonist, mainly liraglutide. This injection is prima facie used to help diabetic patients who are obese to control the sugars. Both daily dosing and weekly once dosing is available. The second class of drugs which is new is known as gliptins or DPP-4 inhibitors. Again, it is expensive but very effective if the patient wants to avoid insulin. This is usually combined with the old drug metformin. And the third treatment that is now being advocated for diabetes is bariatric surgery for patients who are having BMI of more than 35. So these are the three modalities that we use to treat diabetic patients. But nothing is more important than a disciplined lifestyle to be adopted by both youngsters, middle-aged and elderly people. I will also emphasize the importance of sleep in diabetic patients. One major reason for diabetes being uncontrolled is the lack of sleep amongst most of us. You need at least 7 hours of adequate sleep daily, combined with the above points that I had mentioned regarding diet as well as medications. You need to cut down the unhealthy starch, carbohydrate foods in your diet and avoid binge eating. This is mainly about diabetes, and just briefly about internal medicine. We cater to all undiagnosed fever cases at Lakeshore Hospital, which is done by my senior doctors as well as by myself. And for that, the only advice I give to patients is don't self-medicate and do not take antibiotics on your own or on prescription from a pharmacist. It should be only done after consulting a doctor.